The Secretary to the Government of the Federation, honorable ministers here present, ladies and gentlemen of the press, good evening. As at today, early today, the 20th of April, a total of 627 persons in 21 states and federal capital territory have been confirmed to have a COVID-19 infection. The 86 new confirmations are distributed as follows: 70 in Lagos, 7 in the FCT, 3 in Akwa Ibom and Katsina, and 1 each in Bauchi, Borno, Jigawa, and other states. 21 deaths have been recorded so far, one of whom sadly is Malam Abba Kyari, Chief of Staff to His Excellency the President Muhammadu Buhari. May God rest his soul. 170 people have recovered from COVID-19 in Nigeria and have been discharged, and that leaves 436 persons who are currently actively recovering from the infection. 13 molecular diagnostic laboratories nationwide are activated so far by the Nigeria Center for Disease Control, and the target this week is to double the national testing capacity, which stands at 1,500 a day. Our strategy, now focusing on the community, has kicked off the increased community testing and social mobilization at the grassroots level. The worrying increase in the frequency and numbers of new persons with COVID-19 being recorded daily is attributable to this new strategy in combination with higher community transmission. A new national action plan is under development to adjust and address this development. There is also renewed emphasis on further increasing and improving isolation facilities because testing and finding more infected persons goes with a strategy to accommodate them. There are isolation and treatment centers all over the country to meet the security, privacy, and comfort needs of all persons. The Director General of the NCD is currently on inspection of these facilities nationwide. With regard to imported cases, everyone entering Nigeria from outside the country will be required to enter a mandatory supervised 14-day quarantine in a designated facility. The same applies to contacts of such persons. State governments shall be preparing a minimum of 300 beds for isolation and treatment, and also to explore all options, including engaging hotels for quarantining persons who may have COVID-19 or those who have mild symptoms and need little clinical management. Citizens are reminded to take responsibility through physical distancing, appropriate use of masks or improvised face coverings, maintenance of hand and respiratory hygiene, as well as faithful adherence to the lockdown measures and regulations in place. The use of masks, be they disposable or cloth masks or other face coverings, is advised for all activities outside your home, and now especially in the hotspot states of Lagos, FCT, and as we are seeing, Kano. I would like to encourage the mass production, donation and distribution of washable, reusable cloth masks by philanthropists to vulnerable groups, and generally to members of the public to further contribute to reducing the risk of transmission. A strict guide for the use and maintenance of cloth masks is in development and will be publicized. Suffice it to say that your masks must be washed every day and, if possible, ironed. I shall again use this opportunity to talk to health workers to take reasonable precautions when attending to all patients in health facilities and to approach patients with relevant symptoms with a high index of suspicion and observe the universal precautions on infection prevention and control. The federal government has a responsibility and capacity to manage dangerous viral infections safely in the interest of public safety and national security. Please work with the Federal Ministry of Health and the NCDC on surveillance and on referring patients for testing or to isolation and treatment centers. Observe the physical distancing, practice hand and respiratory hygiene, use your masks or improvise face coverings, and comply with government policy on the lockdown. Thank you for listening.